Hello, today we're doing our SRT analysis video for Chance, who's a 1-year-old German Shepherd. The problem list included, on the day of the evaluation, we had history of paw pain, history of limping, short-term loss of appetite. He experiences pica, which is eating things that's not food, so roses outside and stool. And he also is anxious to loud sounds. And so SRT, these are the presentations of Chance's genetics plus environmental stimulus. And so being a German Shepherd, his genetics are based on that breed, but then the environment can exacerbate certain things in that genetic pool that can bring on the potential for injury. German Shepherds are known for muscle and skeletal problems, and sometimes digestive problems as well, which he's trying to solve something down here. So short-term fasting or eating things in the environment, Rose may have some medical implication to him that makes him feel better. Certainly when dogs eat stool, they're trying to basically transplant the digestive enzymes and bacteria again, so they'll sometimes recycle their stool in the ability to do that. Anxiousness to loud sounds. German Shepherds tend to be very aware of their surroundings and very sensitive to noise, as they are designed for protection and for herding and also for pack mentality. And so sometimes when they're alone, they're a little more anxious because they're kind of they're their own pack, if you will. And then they're trying to protect the environment, so they want to make you aware as well as make themselves aware that there's something in the environment that's bothering them. Doesn't necessarily mean a disease, but the number of things that he had for dis-ease. Main takeaways, if you look at his abnormal list, he had a number of abnormals, but what I'm really focused on initially is what's bringing on these things. So paw pain, limping, number one. He had lateral anterior leg and quadratus, which were more acute, which says, okay, they basically just happened, so they're above 20. So if we look at the cycle, positive 20, negative 20, this is ideal healing range. And when his musculoskeletal system, when it goes to acute stress, means it's up here and coming back down, hopefully to resolution and not going to chronic over here. So this happened fairly recently. It wasn't a chronic problem or something early in his genetics because he's only a year old. So short-term resolution of that is based on the histories. He got better after one day. So he did solve his own problem there, but we want to make sure that residual inflammation or residual stress is cleared out with this hemp oil drop. So that's what the hemp oil is going to do, is balance that so it goes on and stays in this range. So that's dis-ease that created a symptom over here. Dis-ease will create symptoms. The question with loss of appetite is that he had a number of chronics there, 2 environmental toxins. And so whenever they fast, they're basically clearing something out of the system. So it's on purpose. So they don't want to keep eating if their body already is developing toxins from the environment. So he allows those toxins to dissipate before he resumes an appetite. And that's very smart because dogs' short-term fasting is very good. But he's also telling us, okay, I have some digestive change here that I need resolved. And most of that was more environmental reasons versus digestive reasons. So, and he was in the chronic range for that. So he's sitting in this region for those particular allergens, and those allergens are sensitivities right now, so they haven't become permanent. And so that's where the SRT drops come in, as they reduce the risk of becoming more of a permanent problem as he ages. but we're also helping him to reset himself at a young age and keep him tuned up so we don't lead to those chronic problems that we see in the classic German Shepherd. Okay, so this is a good start. I know there'll be questions. I want you to watch the video and look over his test results. With SRT, when it's new to us as clients, there's a lot of questions that come up, and so I want to feel like that you can ask those freely, because there's a lot to learn. You know, it's unlike conventional medicine, pretty straightforward. If he had pain, he'd be on pain relief. If he had digestive upset, he'd be on some appetite stimulants. But we're getting to the root of the problem, so there's a lot of data that comes up. It can be somewhat confusing, none of which is permanent. This is a FDA-approved medical device to give us information, but it doesn't give us diagnostic ability to say that this is a disease permanent. But it says there's dis-ease, so that's what we want to monitor and give him supplementation, so it doesn't become a diagnosable problem over here. We want to make sure that he stays in tune all the time. So thanks for doing the SRT program. Look forward to continuing to working with Chance, and watch the video and let me know if you have questions. Thank you.